When assisting a resident with hemiplegia to dress, which side should be dressed first? A. Strong side. B. Weak side. C. It does not matter. D. Alternate each day. Answer B. The weak side should be dressed first to make movement easier and reduce discomfort, while undressing should start from the strong side. A resident suddenly becomes unresponsive during feeding. What should the CNA do first? A. Call the nurse immediately. B. Perform abdominal thrusts. C. Offer water to clear the throat. D. Wait to see if the resident recovers. Answer A. Calling the nurse immediately notifies help, but first priority is to relieve the airway obstruction before seeking assistance. Which of the following requires contact precautions? A. Influenza. B. Tuberculosis. C. Difficile infection. D. Chickenpox. Answer C. Difficile spreads through direct and indirect contact, requiring gloves, gown, and hand washing with soap and water. When transferring a resident from bed to wheelchair, which safety step is most important? A. Positioning the wheelchair at a 45-degree angle. B. Locking the wheelchair brakes. C. Removing the wheelchair footrests. D. Placing a pillow in the chair. Answer B. Locked brakes prevent movement of the wheelchair, ensuring safety during the transfer. Which observation should be reported to the nurse immediately? A. Resident has a poor appetite. B. Resident has not had a bowel movement today. C. Resident requests a blanket. D. Resident complains of new chest pain. Answer D. New chest pain may indicate a life-threatening condition like a heart attack and must be reported immediately. Which is the best method to prevent falls in residents who are confused? A. Raise all side rails. B. Place call light within reach. C. Use a restraint belt. D. Keep resident in bed at all times. Answer B. Confused residents should not be restrained, instead, ensuring access to the call light promotes independence and safety. Which action by the CNA promotes dignity during perineal care? A. Completing the care as quickly as possible. B. Asking another aide to help without consent. C. Keeping the resident silent during the procedure. D. Explaining each step before doing it. Answer D. Explaining steps respects the resident's dignity, helps reduce embarrassment, and builds trust. Which is an early sign of hypoglycemia a CNA may observe? A. Slow breathing. B. Sweating and shakiness. C. High fever. D. Sudden chest pain. Answer B. Sweating, shakiness, and irritability are early signs of low blood sugar and should be reported immediately. Which device helps prevent foot drop in bedridden residents? A. Abduction pillow. B. Bed cradle. C. Footboard. D. Special mattress. Answer C. A footboard keeps feet in proper alignment and prevents foot drop, a common complication of immobility. A resident with dementia is pacing and restless. What should the CNA do? A. Tell them to sit down. B. Offer a calm activity. C. Use restraints. D. Ignore the behavior. Answer B. Providing a calm, safe activity helps reduce agitation without restricting the resident's independence. Before weighing a resident in a wheelchair, the CNA should first: A. Subtract the wheelchair's weight. B. Ensure the resident is wearing shoes. C. Record weight with wheelchair included. D. Use the same scale each time. Answer A. The wheelchair's weight must be subtracted for accuracy, otherwise the measurement will be incorrect. What is the safest way to identify a resident before giving care? A. Ask the resident's roommate. B. Check the name tag on the bed. C. Use the identification bracelet. D. Ask the family member. Answer C. The ID bracelet provides the most reliable identification, preventing errors in care. Which of the following best demonstrates respecting resident rights? A. Keeping all doors open. B. Entering without knocking. C. Allowing residents to refuse treatment. D. Deciding the resident's bedtime. Answer C. Residents have the right to refuse treatment even if it affects their health, and CNAs must respect this decision. A resident who has dysphagia is at greatest risk for A. Aspiration. B. Constipation. C. Skin breakdown. D. Dehydration. Answer A. Difficulty swallowing increases the risk of food or liquid entering the airway, leading to aspiration. The CNA notices a resident hiding food in their napkin. What should be the next step? A. Throw the food away secretly. B. Confront the resident firmly. C. Report the observation to the nurse. D. Feed the resident more quickly. Answer C. Pocketing or hiding food may indicate swallowing problems and must be reported for evaluation. What is the CNA's role during fire evacuation? A. Gather all medical charts. B. Move residents in immediate danger first. C. Put out the fire with an extinguisher. D. Wait for instructions only. Answer B. The CNA's duty is resident safety, removing those in immediate danger before doing anything else. When providing oral care for an unconscious resident, the CNA must A. Use a large toothbrush. B. Place the resident flat on the bed. C. Turn the resident's head to the side. D. Offer water afterward. Answer C. Turning the head to the side prevents aspiration by allowing fluids to drain safely from the mouth. Which observation is most important when caring for a resident with a cast? A. Cast color. B. Resident's clothing size. C. Swelling or numbness of limb. D. Resident's appetite. Answer C. Numbness or swelling indicates circulation problems and must be reported immediately. The CNA notices blood on a resident's bedsheet. What is the best action? A. Change the sheet and ignore it. B. Report to the nurse immediately. C. Ask another aide to check. D. Wait until next shift to report. Answer B. Any bleeding must be reported at once to ensure the cause is identified and treated. Which skill requires the CNA to wear gloves? A. Measuring oral temperature. B. Transferring to wheelchair. C. Assisting with oral hygiene. D. Shaving a resident with safety razor. Answer C. Gloves are needed for oral care to protect both resident and CNA from contact with saliva or blood. A resident with Parkinson's disease has tremors when eating. How can the CNA assist? A. Feed them completely. B. Provide weighted utensils. C. Tie their hands gently. D. Limit meal time to 10 minutes. Answer B. Weighted utensils help reduce tremor impact and encourage independence in eating. Which is the best way to handle a resident's confidential information? A. Discuss with coworkers in hallways. B. Share only with staff involved in care. C. Tell family without consent. D. Post updates on bulletin board. Answer B. Only staff directly involved in care should access confidential information to maintain privacy. Which vital sign change should be reported immediately? A. Temperature of 98.4 degrees Fahrenheit. B. Respirations of 14 per minute. C. Blood pressure of 180/100. D. Pulse of 76. Answer C. A blood pressure of 180/100 is dangerously high and requires urgent medical attention. What is the best way to encourage independence in a resident with limited mobility? A. Do everything quickly for them. B. Allow them to do tasks they can safely perform. C. Refuse to help until they try. D. Ignore their requests for assistance. Answer B. Supporting residents to perform safe tasks promotes dignity and independence. A CNA hears another aide verbally scolding a resident. What should be done? A. Join the conversation. B. Report to the nurse immediately. C. Ignore the situation. D. Laugh it off. Answer B. Verbal abuse must be reported at once, as it violates resident rights and facility policy. If a resident refuses a bath, the CNA should A. Force them to bathe. B. Document as completed. C. Report to family immediately. D. Respect the refusal and try later. Answer D. Residents have the right to refuse. The CNA should respect their choice and attempt later if appropriate. Which infection control step is required after removing gloves? A. Shake hands dry. B. Wash hands thoroughly. C. Use lotion only. D. Put on new gloves immediately. Answer B. Hand washing after glove removal is essential to prevent transmission of microorganisms. Which position is safest for a resident receiving an enema? A. Supine. B. Fowlers. C. Left Sims. D. Prone. Answer C. The left Sims position allows the solution to flow naturally into the colon, making the procedure safe and effective. A resident suddenly complains of shortness of breath while lying down. What should the CNA do first? A. Call the nurse. B. Place the resident in Fowler's position. C. Offer water. D. Take blood pressure. Answer B. Sitting upright helps improve breathing immediately, while the nurse is notified for further care. Which is the correct response if a resident's family asks about their medical diagnosis? A. Give details from the chart. B. Explain test results. C. Direct them to the nurse. D. Share what you overheard. Answer C. Only licensed staff can provide medical information. CNAs should direct family to the nurse.